My name is Mick Dolan and I'm part of the National CUR team that works for NHS England, leading the Clinical Utilisation Review Programme. It's called CUR or CUR. Today I've come to the event to talk to CCGs, provider organisations about the value of the tool and in effect how it's sponsored by NHS England as part of one of the sequins that is in the contract for this year. CUR effectively, or Clinical Utilisation Review, is a clinical assessment. It's undertaken by clinicians at the bedside for every patient for every day of their stay in a hospital or a community setting. It uses criteria to determine basically whether the patient is in the right place at the right time, at the right level of care. Effectively, it's backed by an international evidence base and it involves assessment against a set of criteria that are dependent on where the patient is in their patient journey or the care pathway or the pathway of care. You can use the tool. It's actually software that the clinician uses to make the assessment at any level of care that you'll find within a set of hospital and community services. So right through from critical care, HDU, through to the normal acute bed base that you'd find in a hospital service, into the community, into rehab and intermediate care services. So what we found over the last few months or so, it's a 3-year sequin that we've been investing in as part of NHS England. We've got 5 early implementer sites and we've been collecting data from those early implementer sites. We've got 2 quarters worth of data. Most trusts think that they know the reasons why patients are in effect inappropriately delayed in a hospital bed. They normally for reasons that are external to the organisation, lack of capacity in the community, or sometimes the non-availability of services in the community or primary care. Effectively, what we've got in terms of that data from those first 2 quarters, we've been able to, on average, we found that there's between 60 and 70% of the reasons for inappropriate stay are actually down to hospital-based reasons. Of the assessments that have been undertaken by the trust that have been using the tool, actually 40% of the assessments that have been undertaken don't meet the CUR criteria, these internationally evidence-based criteria for whether a patient should be in the right place at the right time at that level of care. 40% of your hospital bed base is a significant cost. Even on the 5 EIS sites that we've had using this tool, they've been using it across roughly about 1,800 beds. If we did the maths, we're talking about 280, on average 282 beds at those trusts with patients that don't need to be there, upwards of £11 million just at those 5 EIS sites. If you thought about the 57 trusts that should be using this tool as part of the programme in terms of specialist commissioned services, there's a huge potential there for us to work at in terms of improving patient flow. So I've come to explain to people what the tool is, how it works, how it's used by the staff who would be using the tool, how they integrate it with their existing EPR and data systems in the trust, and the types of data that it'll provide in terms of specifically the detailed reason codes for patients being in an inappropriate level of care in their hospital, and hopefully to convince them to use the tool and to roll it out to a bigger bed base during the course of the year. I don't have the details with me, but as part of the presentation materials that's been produced for the event, all of our contact details, there's 4 of us in the National CUR team, are available. Happy for the providers or the CCGs to give us a call and we'll work with them to try and create the right conditions for its implementation in their areas.